People as they age, they go 20 and then they slow down in their 30s and then they slow down in their 40s, and I think that's should be some of the better times of their life.
In the matter of 5 weeks, my life has changed.
I think that it can help a ton of people in a number of different ways.
Prior to training, I had a lot of thoughts in my head. I thought it was only for sexual dysfunction, erectile dysfunction specifically for men. And I thought that's all it's good for, that's all it's treated for. And then the other part was for weightlifters, bodybuilders, competition like that. I thought it was just to put on muscle mass in excess and not really for the average person.
I previously kind of had a bad view or a stereotypical view of hormone replacement and testosterone replacement. I always pictured the bodybuilders who wanted to get big, or the older women who were postmenopausal. I didn't think there was a place for it at our clinic.
My preconceived notion on HRT and TRT really was, it's for old guys. People in their 60s, 70s that really had little to no testosterone. Come to find out, it's almost the exact opposite.
My thoughts really changed quite a bit after the HRT training. I went in thinking that it's only for sexual dysfunction and bulking muscle in the gym, and I came out of there learning that it's for dozens of conditions that have nothing to do with sexual function or gaining pure muscle mass.
Energy, fatigue, trouble losing weight, trouble gaining muscle,
brain fog, trouble remembering things, slight irritability,
sexual issues like performance, loss of libido. Those were kind of all of the typical symptoms that we can address with all of these different hormone replacement peptides.
I was more or less excited to bring something like this back to the greater Milwaukee area and help people that probably don't even realize they're experiencing low testosterone levels.
Before training, I didn't think I'd be a candidate for the program. I thought the stereotypical sexual dysfunction, I didn't qualify for that. Every guy says it, but no problems in the bedroom. We hear that all the time. For me, it was all the other symptoms, the mental clarity, the brain fog, the irritability, the tiredness, the absolutely feel like I got hit by a bus at 1 o'clock on a Saturday, no alcohol involved for a month, eating really clean, and I was still feeling like that. It just didn't add up. My testosterone was pretty much rock bottom, but I have a thyroid that has an issue. So now finding the thyroid, going on the Armour thyroid medication, our hope is that now is gonna start the cycle naturally where my testosterone will come up. Most likely I will eventually have to go on a little bit of testosterone to maintain my testosterone levels where they should be.
I didn't think that I'd be a candidate for this program, and I didn't think there was anything that we had to offer that would benefit me. I used to be really active. I did CrossFit for a while, and I liked having a little bit more muscle definition. I liked feeling fit. And so I just thought the answer was ultimately eating better and getting back into the gym. And I started to clean up my diet, but the weird part is every time I would eat, and I was eating what people would consider clean, lower carb and higher protein, I just didn't feel good. And for what I was eating, I should have been losing some weight and seeing my body composition change, but it wasn't. But again, it never really crossed my mind that this new program we're offering was gonna be something that would benefit me. I was surprised when the results came back. And for me, I ended up having a low thyroid, specifically T3, which is the active thyroid hormone. And I also had very high thyroid antibodies, which if those get high enough, you can have a condition called Hashimoto's, which is basically your body starts attacking your own thyroid, and you go into this state of hypothyroidism. And so in people who are hypothyroid have trouble losing weight, they have trouble with energy and fatigue, and if those are some of the symptoms that I was experiencing, but just thought that it was related to my work environment and just being not motivated enough to get into the gym.
I did a blood draw on myself and come to find out that my testosterone levels were within normal range per the AMA standards, but they were on the low end. There's such a wide spectrum of what is accepted as normal when it comes to that. Really, I guess men function better when their testosterone is not so much like out of the normal range, but on the higher end of normal range. And I think statistically most men hover in that 9, 10, 11 range after their 20s. At our office, we're striving to get like 19 to 21 is our optimal range, is what we found. So you're still not like blowing the charts out with your testosterone. We can optimize it and keep it healthy. It's really cool.
One of the really interesting things is everyone associates testosterone with men, but actually women should have higher levels of testosterone. And we've seen some levels of testosterone coming back for women as low as 3. But what's interesting is that higher levels, something like 150 to 300, have been shown to reduce your risk of getting breast cancer by 50%. And so I've seen that some of the women so far, we've recommended some increasing testosterone. There's a little bit of hesitancy there. But to put it in perspective, the women who are really, really jacked and probably are supplementing with high levels of testosterone are in the levels of 500. But what we're just trying to do is get that number up just a little bit.
Now knowing what we know through all this training, I didn't think I was a candidate, but I'm definitely a candidate, and the results so far are really good. The program's really simple. You come in, blood draw, takes about a week to get all the results back, and then from there, the plan is set.
Blood work, review testing, get your box, get healthy. To keep it pretty simple.
It's very calculated. It's all based on blood work, so it's not something that is subjective. It's not a cookie cutter approach, and it's different for everyone. And the reasons for which you prescribe either peptides, testosterone, thyroid hormone, or dietary changes is different for everybody, but it's all based on blood work.
And the great thing about the program, we have so many options.
So we have our hormone replacement, and testosterone falls under that category. And then we have our peptides. And the way that we can designate those two different categories is our hormone replacement is just trying to get us up to a good state of health. Any symptoms we're dealing with, energy, fatigue, trouble losing weight, loss of libido, that kind of falls into that category. But if you have other health goals or you kind of want to optimize your health, that's what these peptides are for. There's a variety of different peptides. We've got ipamorelin that helps you gain muscle, DSIP, which helps if you're having any sleeping issues, it can help with that. Ibutamorin, so if you're having any reasons for reduced appetite, a good example would be a cancer patient going through chemotherapy and they're just nauseous all the time and can't get food down. Ibutamorin would be perfect for that. Semaglutide, which is amazing at helping an individual lose weight. And we even have things like PT-141, which is to help enhance the sexual experience.
The process to me was simple. It was very easy, very hands-free, long questionnaire to really get the answers or get the symptoms figured out so we're able to help people. So answering the questionnaire honestly, it really helps. And that's what probably took the longest. But other than that, it's very simple and straightforward.
I'm excited about the program because of what it's already done for me.
How much work I put in for my body, eating optimally, getting enough water, drinking enough water, getting 8 hours of sleep every night, mindset work, and I was still struggling. So doing all the right things and I still had problems and there was a missing component. And finding that missing component was huge for me. And now that we found it, it was a simple fix, a slight correction, was one medication for me. And that has really kind of put everything, all these pieces of the puzzle together. And now I feel like I'm performing more optimally. And that's really what I was looking for almost 3 years.
I think as we age, people think that a lot of the symptoms they feel are just part of the aging process. What's exciting is to offer a solution that can help people realize that they can still feel great as they get older.
Come to find out you can help people that are younger than 60, 70 years old. It's kind of cool.
It just fills that gap of we help people with joint pain, we help them get stronger, but when it comes to their actual overall internal health, we have now something that can help them.
If you're on the fence about starting the program, the best thing you can do is maybe you're not even a candidate. Maybe everything is normal. The worst that could happen is we find out what is wrong and why you're feeling the way you are. Even if you decide not to go through with the hormone program, there's different stuff. I mean, there's semaglutides, there's different peptides to help you start feeling better and meet your goals. And just because one thing's low doesn't mean you don't qualify for something else.
The blood work is really easy to do. It's not very expensive. Our blood panel, I believe, is $149. If that goes through your insurance, it's anywhere from $2,500 to $8,000. I just saw an EOB this weekend at a seminar where they showed $8,000 invoice for this blood work. It's amazing at the discount we can get it for to patients because of our buying power with the nationwide group that we're in. So that's what I would say, number one. If you're even on the fence, if you don't know you're a candidate or you don't know if these symptoms would be related, get tested.
It can help a lot of different people. It's not just for people who are bodybuilders, and it's done in a very medically responsible way.
It has a stereotype that it's only for sexual dysfunction or only for people who want to bulk up in the gym, and it's really not. It's for the average person who's just struggling with things like I was.
There's always some type of improvement that can be made in your body, whether it is losing weight or being more energized or even absorbing foods that you generally wouldn't. We definitely will give you an answer. So if you're apprehensive about starting, just because you come in for the blood work doesn't mean you have to go full bore on the program, but we can at least give you an answer.